Houston, Texas, home of the Patient Benefit Foundation, where we care for our community, where we learn about our patients and their specific needs, where we don't let lack of insurance, denials, and steep deductibles prevent necessary surgeries. We make it possible.
It was no fun dealing with that pain. I didn't want to skate because of the pain. I didn't want to go to the gym because of the pain. But now, at 54 years old, I'm back to skating twice a week. I'm hosting my events. I'm going out of town with my events. So I'm back to having fun.
Founded in 2014, the Patient Benefit Foundation continues to offer its services to the Houston community.
My mother migrated to this country after my father passed away, and obviously she did not have insurance to cover her medical benefits. She had to go through worst experience of her life. Her pancreatic enzymes were very high at that point. A patient can die with it, which was my reason to be prompted about creation of a platform and resource for the patients. So my mother became the real reason. She was a motivation, and when I discussed the idea of the Patient Benefit Foundation with her, she equally participated in supporting this organization to be established.
The Patient Benefit Foundation is a very unique organization in my experience. We're helping people who need something that's going to improve their quality of life. It isn't necessarily life-threatening, but it is something that needs to happen.
The American insurance system is pretty much broken. You're paying a lot of money for something and you're not able to be seen in some instances, or your deductibles are so high.
So health insurance is very interesting. We're probably the only industrialized nation in the world that uses a system of private health insurance to pay for health care. So in the US, about 50% of care is paid for by the government through programs like Medicare and Medicaid. The other 50% is paid for by private health insurance, mostly which people gain through employment. If you're unemployed and you have to buy your own health insurance, it can be very, very expensive. As a result, a lot of people, they don't even go through the health exchanges. So any kind of a health crisis, something that comes up where they need care, it becomes financially prohibitive.
Americans are paying more than they ever have for insurance before. Doctors are overwhelmed, emergency rooms are overwhelmed, and that's where something like the Patient Benefit Foundation can help, because for those that can no longer afford insurance or that don't have insurance, now there is an opportunity for them to get the elective surgical care they need.
I saw in many patients that we treated, patient had insurance, but they will not qualify that patient to have that knee surgery or whatever surgery that is. Denying that patient is not the right thing to do.
The Patient Benefit Foundation steps in to ensure people receive the surgical care they need.
As long as I live and I can, I will not charge anybody any co-payment or anything like that.
The Patient Benefit Foundation, empowering patients, transforming lives.